So about 14 years ago, I had a logging accident and a treetop fell on my head, and it was quite traumatic. But the conditions continue to worsen.
Chris had been suffering with neck pain, but also pain in his arms and hands, as well as some numbness and tingling in his arms and hands. He also had some sensations that were kind of odd into his face, where he felt like there might be some bugs crawling.
In the beginning, I thought that I was just crazy, and that my wife agreed that I was crazy, but there was nothing biting me.
We evaluated an MRI that he had of his neck. Most people that have spine problems probably need some sort of imaging study, such as an MRI, to help evaluate their neck or their low back better. In his case, he had a problem in his neck.
There was nothing that I could take or a lotion that I could put on to treat it, that it was actually nerve related. So then the pain just continued to worsen over the last 4 years.
So we talked about that, and we talked about different options. He tried some non-surgical things to try to help his symptoms, and they didn't really help him. Finally, what we settled on doing is what is called a total disc replacement. It's also known as an artificial disc. That surgery involves me operating through the front of his neck, making an incision here when he's asleep, taking out the disc that's pushing on his spinal cord, and then replacing it with an artificial one.
And I also suggested taking the least invasive, procedure first to try, versus the other option was going to be quite a bit of rehabilitation, being laid up a lot longer. And so I appreciate that, being a pastor of a church and a father of 5. I appreciate that, so I can get back on my feet as soon as possible and continue with my life.
In Chris's case, he's an active guy. He's also a pastor in the community. He likes to fish. And although I didn't exactly recommend it, he went back to fishing the day after he had his surgery, and he was doing great. He was happy about it.
Dr. Loganathan told me that I would experience some pain, some sensations, a little bit of burning, but that I did not have to have physical therapy. Just by getting up and being active and moving was more than enough, and everything went exactly the way that he said it would be. And today is, I think, 4 weeks, and I have very little pain, and all those symptoms that I had mentioned are gone.
But he did really well, and he's continued to do really well after that. The symptoms in his arms and hands got better, the bug crawling sensation got better, and his neck pain was better. So all in all, I'm really happy that we were able to do that for him.
I was reluctant to express how I was feeling, because I thought that they might think that I was crazy, because of the bugs that were crawling on me and whatnot. But finding out that was common, and so I was able to express exactly what I was experiencing. And he actually talked about some other symptoms that I was experiencing, like tingling in my hands, maybe my arm falling asleep at night, and just bringing that to my attention. And so I would encourage people to be honest with Dr. Loganathan, because he has gone through there and he understands it. And the more that he understands, the more precise he can diagnose you for treatment.
My philosophy is to really make someone feel comfortable and be able to tell me what it is that's actually bothering them, and give them the space to really express themselves and express what it is that's making them come to my office in the first place. And then I think it's really important to take time to talk to people, to explain what I'm recommending, to explain what I'm thinking in my mind when they're telling me what they're experiencing, to explain what the MRI or CT scan or X-rays show. And I think that helps.
I had my daughter with me the first time I went, and my wife, and I really appreciate him taking time to talk to them. My daughter's 5, and she's sitting here with us today, and she had questions about her dad, and he took the time to explain it. in 5-year-old terms. He had a poster board, and he was pointing things out and explaining that. Instead of just pushing me through as a number, he actually treated me and my family like normal people, and I appreciate that very much.
One of the biggest complaints that I hear from patients about experiences that they've had in the past or their loved ones have had in the past is that their spine doctor was in and out of the room in 5 minutes, and they didn't really have a chance to tell their story, but also to ask the questions they wanted to. I want to the best of my ability, prevent that from happening. So that's really my guiding philosophy in patient care. You know, I almost always first meet somebody in the office, and I definitely want to give them the space and time for us to have a good communication.